Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Brit and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Rachel Tippins, the owner of Flow Family Chiropractic in Kaukauna, Wisconsin. Dr. Rachel was introduced to the chiropractic field when she was a teenager, and she quickly fell in love with the concept of the body healing itself and a career that could support it to do just that. Fast forward to today, and Dr. Rachel now owns a laughter-filled and kid-friendly practice that specializes in pediatric and perinatal care. She says that her biggest passion is to empower pregnant moms through their perinatal journey, as well as supporting families in the postpartum transition and seeing them flourish when their bodies are functioning optimally. In our first 2 episodes together, our conversations answer some of your most common questions for chiropractors as we discuss Chiropractic 101, myths, facts, and everything in between in episode 1, and aligning your mind and body, the anti-stress power of chiropractic care in episode 2. In our 3rd and 4th episodes together, we dive into the more specific topics of like how chiropractic can help your kids thrive and how chiropractic can be a huge supporter for women before, during, and after pregnancy. With that said, even if you don't have kids or are not in the childbearing years, we bet you know someone who is. So please share these episodes with them. Dr. Rachel is such a fun person, and she brings so much of her natural joy, energy, and passion to these episodes. Let's dive into today's conversation.
Hey guys, welcome to the podcast. We're here today with Dr. Rachel Tippins from Flow Family Chiropractic. We're so excited to have you on the show.
I'm excited to be here.
Yeah, we love
so fun.
Dr. Rachel. She gives the best hugs, and she has a gorgeous space up in Kaukauna. So we're really excited to have her here today. So this first episode, we're really going to just talk about all things chiropractic, delve deep into the different kinds of things. And in the following episodes, we're going to even go deeper into your specialties and into different kinds of things. So we are really excited to talk about all this kind of stuff. So before we get started, though, we like to kind of go through some fun facts or 2, whatever. But tell us something fun about you or something new.
Well, this was a hard one. It's hard to figure out like what you're fun, but I got married this year.
Yay.
So in July, which was the best day ever. We had so much fun. And then we're going on our honeymoon to Tulum in a couple weeks.
Where is Tulum?
It's like down the coast from Cancun. So hurricane safe so far, but it seems like it's okay from what I've seen. So, but I think it's kind of like a funky place that you go to your resort, but then they've got like cool markets and like big like sculpture gardens and cenotes and Mayan ruins. Yep. And you have to, right?
Oh my gosh, that's so fun. Can I just come? I don't have to bother you guys.
Third wheel on a honeymoon.
Yeah. I don't have to be there at all. You're invited. Just drop me off. That's awesome. All right, so let's talk about chiropractic care. So let's just start with the first question. Like, what is chiropractic care?
This is a good one. And it's kind of almost a hard one to answer because chiropractic care is in itself like so simple, but also so vast. So I would say that chiropractic is a very natural approach to optimizing your body's health and optimizing your body's function. So I feel like as we keep going, we'll get into more of it.
So are you basically a bone doctor?
Great question. Actually, I would say I'm not a bone doctor. I would say I'm a nervous system doctor.
Ooh.
So and I know one of the other questions we're going to talk about is our neurological approach. So that's something that we do different at my office versus other offices. But in the chiropractic world, you kind of get some different like philosophies and different like variations of care. There are a lot of chiropractors that take more of a biomechanical or a musculoskeletal approach to chiropractic. So really just looking at like how are the joints aligned, how are like the muscles and the bones moving, versus like my approach is very like neurological and a vitalistic side of chiropractic, where we're really looking at how is your nervous system communicating with your body. So your nervous system, your brain, and your spinal cord live within your skull, your cranium, and then within your spine. So we're not just a bone doctor. We're really looking at through the lens of the bones and of your spine into how the nerves are communicating and how your nervous system is functioning and how it's talking to the rest of your body as well.
So what are the pros and cons of each different type of approach that you just said? Like those two different types of approaches?
Yeah. There's definitely like different, within the chiropractic world, there's so many different like ways that you can go in different realms, different specialties and approaches, which is really cool. So within like the more like biomechanical, musculoskeletal side of things, a lot of that's more like pain management, which we need. That's important because a lot of people are in pain, and injury management, that kind of stuff. Rehab, sports chiropractic more so is that kind of side of things, versus the neurological side is more of like the overall like functional wellness and like how can we enhance your overall health, optimize more like visceral neurological complaints, things like that. So that's oftentimes where we see like kids with like bedwetting, and that's how that all kind of like ties in together.
So are there different adjustment techniques then when you look at those kind of different approaches?
Yeah. Yep. Exactly. So different adjustment styles and different techniques within chiropractic it can be used to tailor to different populations, different complaints, things like that. So at my office, we use a mixture of like some manual hands-on adjusting. We also use the drop table where the table pops up and pops down. I'll use a little tool called the activator where I pull a little like trigger button. It sends an impulse with the tip of the tool. But I also do a lot of like tonal adjusting. So instead of like very aggressive, like bones, like you hear like the joints like cracking, popping kind of thing. It's more of just a very light touch that we're really working on balancing the calm side of our nervous system, which is called our parasympathetic nervous system, especially with the population that we see, pediatric babies, that kind of stuff. We use a lot of that like low tone style adjusting, but I also do it in a lot of adults, especially because we see a lot of adults with like extra stress and that kind of stuff.
So I kind of want to back up and figure out I want to hear about how you got into this field, and then also how you kind of picked the neurological approach, and then also how you picked specializing in perinatal and pediatrics. So let's start with like your story. How did you even get interested in chiropractic?
Yeah. So I first like got into the chiropractic world when I was like 13 years old. I was in the shower one morning and I was washing my hair, and like suddenly out of nowhere, I couldn't turn my head. And I like totally freaked out and was so scared. And I was like calling my mom and like, come help me. And my mom came in and we got out of the shower. She helped me get out of the shower, whatever. And then she was like, I'm going to bring you to my chiropractor. And so she brought me in to see my first chiropractor, Dr. Bobby Vorman's, up in Tomahawk, Wisconsin. That's my hometown. And to be honest, I have no recollection of like how the injury or how the neck issue resolved. But obviously it like worked out, and I stayed on care there as like just a wellness patient. So my mom was already a patient there. So, and she just saw the value of like me continuing and like just optimizing my body as I was going through puberty, teenage years, sports, all that kind of stuff. So, and eventually then within the next like year and a half or so, I ended up working there. So I found out that her high school aide, who did a lot of like the back end filing, phone calls, things like that and stuff, was going to college. And I walked into one of my adjustments and was like, hello, I would like this job. So I'm the girl. And it was a small town. She'd already known me, known my family and everything. So I think I walked out of there with like the hiring paperwork, which is like kind of funny. But yeah, so I ended up working there through high school. Fun fact there, for the first like bit of my employment there, I couldn't drive. So I would have to take the bus there after school. So, which was really funny. And then my mom would pick me up like at the end of the shift.
That's awesome.
It was really cool. Yes. An awesome experience and just an amazing mentor in my life too. So, and then after that, I ended up, I think just in my employment, like falling in love with the concept of like our bodies are such incredible beings and they do so much for us, and they can do so much. They have such amazing capabilities. We just need to let them do it. And we just have to like remove the gunk and the interference so that they can do what they're made to do and built to do and supposed to do. So that was really, really cool.
So then when you went to chiropractic school, like you had just mentioned, there's different approaches. I'm assuming you learned about each of those different types of approaches. So how did you narrow in on the approach that you chose?
Yeah. I think a big part of it it was, I always knew I wanted to work with kids. I think if I maybe like hadn't like fallen into the chiropractic pathway, I would have been a teacher of some sorts. So I knew I always kind of wanted to be in like the kids and family realm, and just learning more about like kids chiropractic and like safe chiropractic for kids, because there's a difference between like seeing a pediatric chiropractor and seeing a chiropractor that adjusts kids. Like there is different like trainings and specialties and stuff. I know we'll jump into that more in one of the next episodes. So I think learning about different populations and knowing that that's what I kind of wanted to specialize in, then you like learn more about different techniques to serve those populations. So, and that's also why like finding a niche, I think in the chiropractic world is important and is really cool, because I honestly am a firm believer in the chiropractic realm that the jack of all trades is the master of none. I mean, there's a lot of chiropractors that do like general healthcare, and they'll say like, we see cradle to grave patients. And obviously, yes, everyone's got different perspectives, but I think it's really hard to be really good at each of those different realms. So I think picking a population and really learning how to best serve that population is where you like find the best success.
Well, and I feel like that applies to any industry.
I was just going to say that.
Really?
Yeah,
Doctors, I mean, any type of industry. If you're general, I mean, we do need general family practice doctors, but also if you are pregnant, you're going to see an OBGYN, you know? So it's like the same thing where I agree. I think having a niche is really, really important. So that's awesome. So I think one of the common questions that you probably hear, and you can correct me if I'm wrong, but how often should people come and see a chiropractor?
Yeah. Yep. So that's a really great question. And it's a very general answer. And sometimes people don't always like the answer when they call our office for like a new patient visit. And Haley has to give them the kind of like workaround, but it just very much so depends on what's going on. So at our office, we get scheduled for a new patient visit, and our like second visit is a report of findings. So it depends on what population. Is it like pregnancy, postpartum? Is it an injury? Is it pediatric care? And then kind of depending on past history of different stressors, past medical history, what their body's gone through in the past, current stressors, and then we go through a full examination process. So at my office with taking a neurological approach, we go through an entire string of like functional neurology testing to look at how the brain is communicating with the body, and look at how different parts of the brain are functioning and how the nervous system is regulating back and forth between our fight or flight response, which is our sympathetic nervous system, and then our parasympathetic response, which is our like calm, adaptive, relaxive nervous system.
Do you use certain tools at all? Like, I know that different offices use different tools for that kind of thing.
Yep, exactly. So there's different like styles and approaches out there. I do use a little device to test heart rate variability. So that's a big one that we'll use. And then we do use like a pulse oximeter, that kind of stuff. We check like bilateral scales to see how you're weight bearing and shifting weight between left and right sides of your body. But most of the testing that I do is like it's functional testing. So I'm having you do certain like eye exams. You do a marching test to look at proprioception. We do different like hand tests and stuff like that to really see like how is your body actually doing this.
Mm-hmm.
So with the neurological approach, how does this actually work? When you're doing an adjustment, what are you actually doing to the body?
So an adjustment, really what we're looking at, what we're doing is putting an impulse or a stimulation into the body, and then we're seeing how the brain is like creating a response. So there's been research by Heidi Havik, who is an amazing chiropractor and chiropractic researcher in New Zealand. And she has a whole institute of research and researchers that work with her. But they have done studies that have shown that when you adjust the spine, and when we put like an impulse into the spine, whether it's using the drop table, using the activator, a manual adjustment, or like a tonal adjustment where I'm just holding slight sustained contact, the biggest part of the body that lights up and that fires is the prefrontal cortex. And the prefrontal cortex is one of the parts of our brain in the front here in this frontal lobe behind your forehead. And it's what controls all of our executive function. So that's all of our critical thinking skills, decision-making skills, rationale, logic, intelligence, personality, all those kinds of things. Like basically like what makes you Brit and what makes you Drea is what lives in that prefrontal cortex. So the fact that it's been shown that when we adjust you, and adjustments in chiropractic helps to stimulate and wake up that prefrontal cortex, like we're helping you be a better you.
Yeah.
And helping you like live your best life, which is so cool and so empowering.
What's so interesting is I feel like a lot of people, when they think of chiropractic care, it's number one, they feel it's just completely optional.
Yeah.
You know, number two is that they just think that it's just when you have an injury or when you're in pain.
Yes. Yep. Exactly. And that's a huge myth that I think is a big part of our approach with like a functional wellness approach, is that chiropractic is we're enhancing how your body is functioning, and we're trying to keep your body as adaptable and functional as possible. So obviously we sometimes when we start care, we have to like go through a little bit more like rigorous chunk of care to like optimize and really get your nervous system back in action. And then after that, like, why would you not want to keep that? And why would we not want to like keep preventing issues from popping up? And so at our office, what we go through is 2 different phases of care. And our second phase of care is called lifestyle care. And we call it lifestyle care because at that point, we want to use chiropractic to help support your lifestyle so that you can keep doing the things that you want to do and love to do and need to do, and not worry about XYZ issues like popping up in the future. So, and that being said, obviously things are going to happen, but our goal is to keep your body as resilient as possible so that when things do happen, if you do get sick, if you get injured, we can help you bounce back and help you recover as best as possible.
I love that. I think so. You're a wellness advocate, essentially,
100%,
which is amazing.
Yeah. Yep.
And like you said in the beginning, I think it's awesome that you chose a career where you are literally just helping the body mend itself. Like you're just setting it up for success in that way, which is just so fun. What other types of wellness do you incorporate into your practice? So for your patients, do you help them with like nutrition or like stretching exercises, or what does this look like?
Yeah, that's a big part of like what we focus on, is just giving the best advice we possibly can for optimizing overall function and overall wellness in our bodies. So starting from nutrition, hydration, different like supplement recommendations. I talk a lot about sleep, a lot about like gut health and gut function, that kind of stuff. Stress is a big part of that because stress plays a big role in our lives. So we talk about how we can reduce different stressors and different kinds of stress in our lives. And then definitely a lot of like different exercises, recommendations for things, depending on if it's like, okay, my baby is like kind of struggling to crawl. Like, how can we work on that? Or like pregnancy, I've got like some lower back stuff that's going on, or some core stuff going on, or just even like we've got so many people that are on like preventative wellness care that like work at a desk. Like, how can I like stop the whole forward head posture thing? And what can I do to like
That's real.
offset that? Yeah, it's so real for so many of us. And like at such a younger age than ever before. So,
oh yeah, for sure. I can see that in my kids too. And I'm constantly like, posture guys, posture.
Well, this is bringing
our
us
realm.
back to when we were young. You remember Mom always talking to us about bring your shoulders back, girls.
And we didn't even have phones back then. So,
Right,
exactly.
Oh my goodness, that's so true.
Yes.
So if somebody does not currently have a chiropractor and they're looking for one,
yeah.
Obviously you're sharing about your neurological approach. I think this sounds amazing. But what about somebody who's listening to this in like Michigan? You don't offer a virtual service for chiropractic.
Unfortunately, it doesn't work like that. Yes.
So when somebody is looking for a new chiropractor, what are some good questions for them to ask to make sure that they're finding someone who's a good fit? I mean, whether it's personality wise or it's approach wise.
Yes. And I think that chiropractic is just like anything else in the world, and just like finding a therapist, and just like finding like nutritional habits and a diet. Like there's not a one approach like fits all. Like you really have to find like the person that fits best for you. And I think that personality is a big part of that. I really think that taking a full, well-rounded approach, so making sure that in like the history, in the consultation, that person is asking about like your lifestyle and your dietary habits and your stress, because all of that plays a major role in how our bodies are adapting. And then of course, just determining like, okay, are you looking for a chiropractor for like injury style things or like sports management kind of stuff? Then you want to look for someone that has like extremity certifications and extremity training. Or if you're looking for a chiropractor for more like kids and family wellness, then you want to find someone who specifically has trainings and has background in like how to adjust kids and safe ways to adjust kids, and has training in like prenatal and perinatal care. So from that realm, in the perinatal and the pediatric side of things, there's a website called icpaforkids.com. It is the ICPA is the gold standard for pediatric care in the chiropractic world, pediatric and perinatal care in the chiropractic world. So pop on there. They've got a search bar. You can put in your zip code, your address, and find people that are close to you. And then their websites will link directly to that.
Yeah, that's perfect. I love resources like that. What about one for women who are pregnant?
Yeah.
Where are there any recommendations on websites to search for a specific chiropractor that has specific certifications that are kind of gold standard?
Yep. So the ICPA would be the baseline for that as well. So ICPA is like pediatric perinatal realm on the ICPA's website. The biggest like baseline that I think is most important is the Webster technique because it is the only chiropractic technique that has been like proven and like is used specifically for pregnancy. You can use it in other realms as well, but it's designed specifically for pregnancy to create and like balance the pelvis. So that's a baseline to start, but then looking for other certifications like the birth fit certification and the perinatal certification from the ICPA and spinning babies trainings and things like that, I think are really important.
What is birth fit?
So birth fit is an organization that focuses and centers on how to support moms from a community aspect, but especially through movement, pre-conception, prenatal, and then into postpartum as well.
Okay. And you hold that certification, correct?
Yeah. Yep. So I'm a birth fit educator. So I've gone through, they've kind of like remodeled and restructured some of their trainings and stuff. So I've gone through 2 of their different trainings, birth fit educator and the birth fit coach training, just to learn so much more about the changes that happen like during pregnancy and during postpartum and how we can help like rehab and optimize like core function and core stability before and during and after those times.
And that's so important for women because and they're coming in and they're complaining about something and you have some more background than just, if you will, chiropractic, 100%. It's more than that. And you can help them with their lifestyle too. So that's awesome.
All the birth fit training was not directly related. Chiropractic plays a role in it. And the woman that founded it is a chiropractor. But there's so much more training on just like the core stability and how our core changes that I would not know it had I not gone through like the birth fit training.
Yeah, and we can definitely appreciate that. That's for sure. From our realm of things as well. So
And we're going to dive more into pediatrics in its own episode, as well as perinatal care in its own episode. So we'll dive deeper into those topics shortly. But Rachel, if anyone is listening to this and they're like, you know what, I just have some questions for Rachel. I want to connect with her. What's the best way to reach you?
Yeah. So you can check out our Instagram page, Flow Family Chiro with an underscore. We are on Facebook as well, Flow Family Chiropractic. We're up in Kaukauna. So people are always like welcome to pop in for an office tour. Sometimes it might be a little bit chaotic. Sometimes you walk in and things are like kind of Zen mode and it's a little bit quieter. And sometimes you walk in and there's a baby crying and 3 toddlers running up and down the hallways and it's a little bit chaotic and we love both ways. So you can always pop in and just kind of see what the vibe is going on there or give us a buzz. Our website, our phone numbers on our website and our Google listing and everything too. And Haley or one of our other like front desk girls is always happy to chat a little bit more. And then I'm always happy to give a buzz back if I need to and just answer more questions. So our biggest thing is making sure that people feel informed and empowered and get their questions answered because we don't know enough about our bodies and how everything works. And I feel like the advocacy is a big part that we're very appreciative and like supportive of.
Yeah, absolutely. And I appreciate your openness and just being willing to chat with people too, because chiropractic can be intimidating to some people.
Yep,
I
totally.
think, until you actually get to know what it truly is and how it can support your body.
Yes. And see different styles of chiropractic, especially like the internet these days. Oh God, there's the TikToks and this and that. And it's all for like likes and follows and trying to go viral. And a lot of it is not actually like functional specific care that's trying to get people better. It's just trying to get like hype on the internet.
Well, can we just say that about everything, right?
Yeah.
Like everything health and wellness too.
It's crazy.
My gosh. Yeah. Apply that to every episode that we ever do.
Well, that's why finding someone who's local to you that can help you like decipher and crawl through those weeds and actually understand what's good for you and your specific unique body or your kids' bodies. That's important. Thank you for joining us on this episode, Rachel.
Absolutely.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.